Hello, my name is John McGinley. I'm a public health student at Elon University, and this project is about the mental health status and access to mental health care within the Montagnard migrant community in North Carolina. I'm going to provide some brief background information on the Montagnards. So, the Montagnards were a diverse group of indigenous tribes living in the Central Highlands of Vietnam. In the 1960s, they served as allies to the United States during the Vietnam War, and following the war, they faced a violent persecution. They were forced to flee into the jungle where they lived for years, facing the constant risk of starvation, animal attack, and the threat of being captured and tortured. So they migrated from Vietnam to the United States in three waves in the 80s, 90s, and early 2000s. And at this point in 2021, there are over 12,000 Montagnards in North Carolina, and a majority of them are in Guilford County. So this research aims to answer two primary questions. First, what is the mental health status of four generations of Montagnards? And secondly, what issues of access to mental health care are present across those generations? So what are those generations? Well, the first generation, the oldest one, these were people who were 50 years old or older in 2020 when we conducted our interviews. So these people were children and teenagers during that post-war persecution period, really experiencing a lot of trauma firsthand. Many of them may have served as soldiers. And then moving on to the second generation, 35 to 49 years old, these people were young children during that same post-war period. So again, really experienced some of that trauma of the persecution and the migration. The third generation is a little bit more variable in their experiences. So some were born in Vietnam, whereas others were born in the US. And then finally, the fourth and youngest generation, people who were 18 to 24 years old. These participants were majority born and raised in the US, so lived their whole life in the United States. Working with the community has been central throughout this research project. So we work with a community advisory council of members of the Montagnard community, and the goals for this project were developed from stated community needs from this board. So both mental health and elder well-being were both stated needs. The Community Advisory Council also helped us develop our survey tools and made sure that everything was culturally appropriate. And we were actually the first study to be granted formal approval by this advisory council. So this project really marks a step forward in community-based research in the Montagnard community. We conducted semi-structured interviews from March through July of 2020. We did have interpretation available to those who needed it. And these interviews had two components. First was some mental health screening. We screened for depression, anxiety, PTSD, and alcohol abuse. And second was a series of open-ended questions around access to mental health care. We shifted to a virtual format to accommodate the coronavirus pandemic, but all of our interviews were recorded and transcribed, and we used the Dedoose software package to conduct a framework analysis of these interviews around 5 dimensions of access to care, which I'll get into on the next slide. We had 26 participants total, and you can see the breakdown across generations on that slide. It was weighted towards the younger generations. So, what are these 5 dimensions? Well, first is approachability. This really gets into the ability to perceive that a need exists and a service is out there to meet that need. Next up is acceptability. This is the ability to seek, and it really involves a lot of those cultural factors around stigma and cultural norms. Availability and accommodation is the ability to reach, and that gets into a lot of the logistical factors. Affordability is the ability to pay. It includes both the cost of the service as well as characteristics of the individual, such as income and insurance status. And finally, appropriateness is the ability to engage. So once you get to the service, what quality is it? Is there a language barrier? Is it culturally appropriate? Things like that. Now we're going to get into the results, so we'll start with mental health status, and then we'll go one by one through each of those dimensions. This is a quote from a member of Generation 4 that really summed up a lot of what people were speaking about. This participant said, "I think with mental health in the Montagnard community that highly needs to be addressed is the trauma of refugee camps. I think it's something we subconsciously kind of put off because we want to have a strong facade in America, and we want to be the best that we can. So we're like, okay, we're strong, we're strong. And I think it's okay to not be strong. And I think it's okay to have conversations about being hungry and starving and seeing your child at the brink of death. I think we need to have that conversation so we can heal." On this slide, you can see the results of our mental health screenings. Notice that there's a significant generational divide here. The younger generations had higher rates of mental distress than the older ones did, and we actually didn't find any occurrence of mental illness among those older two generations. This was surprising given older Montagnards' direct experiences of trauma, and there are 3 possible explanations for this. First, it could be an accurate reflection of older generations' mental health. we heard during our interviews that elders have a really strong sense of community among each other, and community and social networks can definitely help to relieve some symptoms of mental illness. The second possibility, this could just be a result of the lower sample size of older generations. And the third possibility is that maybe the older Montagnards were less open on the mental health screening. So we heard in our interviews that elders tend not to discuss mental health and to keep emotions really inside, so this is definitely a possibility. Next up is approachability. This is a quote from a member of Generation 4. They said, "We have a lot of pride and a lot of I can fix it myself attitude, and we'll take that to the death if we have to. It's just part of who we are. We're so self-independent, and we collectively help each other, but when it comes to ourselves, we always brush it off like, no, I'm fine, don't worry about me." The first finding from this dimension relates to mental health literacy. So 81% of younger generations were able to define mental health, while only 25% of older generations were. So there's a real lack of understanding of mental health among the older Montagnards. And connected to this is the idea of parents not understanding, which was brought up by quite a few of the younger participants. So they spoke about how it can be a big challenge when children are going through something and are maybe experiencing symptoms of mental distress because they feel like they can't go to their parents because their parents aren't going to understand where they're coming from. Next up, there were a couple of health beliefs that came up during our interviews. So the first one is the connections between spirituality and mental health, which 8 participants spoke about. So there's this idea that mental illness could be due to demon possession or could be a sign that someone is weak in their faith. So these associations can really make people less willing to be open about mental health and less willing to talk about it. Secondly is the idea of medications being addictive. Of course, sometimes medications really are addictive, but this health belief seemed to extend even to situations where that wasn't really the case. And next up, what resources did people go to if they were feeling mental distress? So friends, religion, and family were the biggest ones that people talked about. But another really important idea that came up was that of self-reliance, which was brought up by 19% of our participants. So these people spoke about how if they were experiencing signs of a mental illness, they wouldn't really go to anyone for help. They would rather just rely on that sense of inner strength. And all of this is connected to the idea of people minimizing symptoms of mental illness and not being totally open about it. Acceptability. This participant from Generation 3 said, "Yeah, I think it's very taboo to talk about mental health. I think we don't really talk about mental health unless it's very visibly known. So like someone tries to commit suicide or has a drinking or drug problem. I guess we don't really acknowledge it until it's really bad. And so there's not really any talk about like, oh, are you feeling sad?" One of the biggest findings from this dimension was the stigma around mental health and mental illness. So 75% of our participants thought there was stigma around this topic. And some of the negative characterizations that came up about people with mental illness included that they are crazy, violent, or weird. People spoke about how having a mental illness is seen as something shameful and embarrassing, and that contributes to a lot of people keeping it a secret. So mental health is just not really discussed in the community. The feelings are kept inside. This is something that almost half of our participants spoke about, and seemed to be especially prominent among elders. Part of this could be due to the cultural values of strength and stability, so people don't want to be seen as weak or hurt the family reputation. Next up is availability and accommodation. So this participant from Generation 3 said, "Community-wise, too, sometimes not a lot of us have available rides. They might not be able to take a day off because you could be the breadwinner or, someone that helps bring money into the family." The biggest issue within this dimension seemed to be transportation, which 6 participants mentioned. Other issues mentioned by fewer participants included appointment making, finding a good provider, location, and opening hours. Affordability. This participant from Generation 2 said, "Even me, I'm afraid to go to the doctor. When my wife went to the doctor last time, just 3 days, 3 nights, cost me $21,000. That's the reason. We can't afford to go spend doctor. I told my family, my wife, my kids, until I cannot move, I cannot talk, that's when you call emergency, dial 911. So almost 3/4 of our participants felt that the cost was prohibitive to receiving care, and 65% felt that the cost was prohibitive for obtaining medications. 62% spoke about issues related to health insurance, so the cost of services and health insurance is a really big problem in the community that really is stopping people from getting the care they need. The limited availability of jobs, especially for people who maybe aren't totally fluent in English or are migrants, means that people can't risk taking time off to go to a healthcare appointment. Finally, appropriateness. So this participant, a member of Generation 3, said, I would just be really frustrated when I went to the doctor with my parents because I felt like I couldn't do my part to help them, and then the health professionals couldn't really do their part because the translation was very hard or we couldn't really get to the real problem. The most significant issue in this dimension really seemed to be those communication issues, with 58% of our participants mentioning it. The language barrier is a huge issue, especially for the elder adults who aren't as fluent in English. Additionally, some services don't have the level of cultural appropriateness and understanding necessary. So 38% of our participants said that professionals wouldn't be able to understand. So, in conclusion, while this was a smaller study, there were several really key takeaways. So there are significant levels of mental distress in the community. Younger Montagnards are experiencing higher rates. There is a tendency not to acknowledge, talk about, or seek help for mental health issues. And part of this comes from the cultural values of strength and self-sufficiency. So really summed up by this quote, "It's okay, we're strong, we're strong." And there are pervasive negative beliefs about mental illness, especially among the elders. Really key throughout this study has been involving the community, and we've been very purposeful about making sure that our results are shared back with the community. So we have produced a video in Jirai, the native language, talking about this study and some mental health tips. And we also are working with the Community Advisory Council and Montagnard Dega Association on the social media campaign with the graphics on this slide. Thanks so much for listening. If you have any questions, please feel free to jump into our discussion room and I'd be happy to talk with you farther.